Hello and welcome to the program. I am Ogechukwu Okekwe. The African Union's health watchdog has declared a public health emergency over the growing Mpox outbreak on the continent. Making the declaration in an online media briefing, the head of the African Center for Disease Control and Prevention, Jane Kayesa, said the move was a necessary measure in the face of the alarming rate of spread of the viral infection on the continent. The outbreak has swept through several African countries, particularly the DR Congo. According to CDC data as of August 4th, there had been 38,465 cases of Mpox and 1,456 deaths in Africa since January 2022. We'll go on a short break and the program will return shortly. Welcome back. Still on Mpox, the Nigeria Center for Disease Control, NCDC, has observed a significant decline in suspected and confirmed Mpox cases across the country over the past months, offering a cautious, optimistic outlook on the current outbreak. This development was announced on the NCDC official website, highlighting a significant reduction from the previous weeks. According to the NCDC latest data, 51 new suspected cases were reported between weeks 29 to 32 of 2024, a sharp decline from the 102 cases recorded in the previous 4 weeks. Well, joining me on the program to discuss further is public health specialist, Dr. Nsiabasi Ekanem. Thank you for joining me on the program, Doctor. So the African Union Health Watchdog has declared a public health emergency over the growing Mpox outbreak on the continent, particularly the DR Congo. What would you say led to the resurgence of this Mpox?
Thank you very much for that question. In my opinion, and in the opinion of a lot of other public health professionals, the main reason why we had this resurgence in the advent or the incidence of monkeypox, which is called Mpox, is the cessation of smallpox vaccine. We are very much aware that this is not the first time we're having Mpox or monkeypox in the country, in the African region, and globally. We had it so many years ago, but at the time, the WHO, the CDC, Center for Disease Control and Prevention, and other health regulatory agencies, including the Health Regulatory Agency, borrowing a leaf from the International Health Regulation, advised and implemented a regional vaccination for smallpox. This was because there was, at the time, not a vaccine. There was no vaccine for monkeypox. But it was believed that since smallpox, monkeypox, and even chickenpox and other kinds of another kinds of poxes, if I must put it that way, belong to the same class, that a vaccine that is effective against smallpox can be effective against monkeypox. And the truth is that when that vaccination was rolled out across the affected countries in Africa, the numbers began to drop, the incidence dropped. Even the prevalence rate of monkeypox within the affected countries began to drop because there was a cut in the chain of transmission of the virus from person to person. Unfortunately, over time, the vaccination within these countries dropped. When this vaccination dropped, it now gave what we achieved at the time, which was herd immunity, was lost. And we now had more susceptible people who were now susceptible to monkeypox, and that is why we are seeing the resurgence or the resurgence of this monkeypox. Unfortunately, this time it's coming in two variants, or what we call two clades. We have clade 1 and we have clade 2. But clade 1, we have clade 1 and clade 2. Now, for Africa, Africa is more endemic for clade 1b. And that one, though is not severe, but it spreads much faster. And this is what is happening right now in Democratic Republic of Congo, across the Central African, Eastern African, some part of Eastern African, and Western African countries, and even outside the African countries. Some cases have already been reported in some parts of Europe. Now, this resurgence is because of the inability for the health regulatory agencies within the countries affected to be able to continue or sustain more smallpox vaccination. And like we used to say, when everyone is not protected, nobody's protected, because anyone that is susceptible to the virus or that is infected with the virus can spread it to others.
So why monkeypox shares similar symptoms with other forms of pox? What distinguishes its symptoms from other poxes?
Yeah, thank you very much. Monkeypox, yes, it's similar, like you rightly said, with other poxes like the smallpox, like the chickenpox, and the rest of them, because they have what we call they produce what we call blisters. Now, but for monkeypox, the graduation in terms of how those blisters develop is different from many others. For example, in monkeypox, we have what we call the red lumps. Those tiny lumps, like rashes, that are reddish in color, is very, very peculiar to monkeypox. For other ones, we have like it could just take the nature of the skin, the color of the color of the skin. For example, chickenpox, smallpox, they take the color of the skin. But for monkeypox, you always see that reddish colored, reddish colored, there's a name we call it. Sorry. So, but what happens is, for monkeypox, unlike others, monkeypox is self-limiting. Yes, others are also self-limiting, but it takes monkeypox a longer time, about not less than 2 weeks, to go through the entire cycle. But smallpox is more deadly, and so smallpox kills even before you get to that long period of time. So, and beyond that, of course, monkeypox presents other symptoms like loss of appetite. Yes, there is also weakness, tiredness, and there's also fever and flu-like symptoms, even though these symptoms are also similar to, smallpox and to an extent chickenpox. But monkeypox has a longer duration, despite the fact that it is self-limiting. So they are closely related. That's why they're in the same family. But there are just some clinical differences between monkeypox, and the difference lies in the structure and the nature of those poxes, the structure and the nature of those blisters. And in monkeypox, those blisters at the point get to to let out the fluid and then form a reddish patch, in the skin of the victim. So these are some of the slight differences.
So what would you say are the main factors contributing to this wild spread of Mpox?
The main factors that are responsible are what we call the risk factors that increases the chances of getting or being infected with monkeypox are: first, interaction with animals. Monkeypox is a zoonotic disease, and by zoonotic disease, I mean that diseases that can jump from one species to the other. In this case, a disease that can jump from animal species to human species are called zoonotic diseases. For example, we have the likes of Ebola virus, you have the likes of Lassa fever. These diseases, these infectious diseases are zoonotic diseases. And so human beings who have constant interaction with animals that may have been infected with the monkeypox stand a higher chance of coming down with the virus. We have the virus, studies have shown that squirrels, monkeys, and other rodents within the wild have a higher chance of being infected with monkeypox. So when humans, through their interaction with these animals, get close to these animals, due to maybe due to factors like maybe bites or bruises, and the skin is exposed, or the skin is cut or bruised. Now, any fluid exchange between the animal and the individual can lead to a transmission. And all it takes is maybe, for example, the oral fluid, like the saliva from the animal, during bites. For example, if you get to be bitten by maybe a monkey or a rodent or any of those animals that has been previously infected with monkeypox, then that is a very, very good channel or mode of transmission of the virus from the infected animal to the individual, especially if the individual is susceptible. And by that, I mean, if the individual has not been vaccinated, then he or she stands a higher chance of contracting the virus from the infected animal. So for animal to man or animal to human transmission, closeness to animal is one of the very fundamental risk factors. Now, another risk factor is in a lack of vaccination, because, like I said, whether it is from animal to human or from human to human, lack of vaccination exposes an individual, renders an individual susceptible to monkeypox infection. So if one is not vaccinated, his immunity or her immunity has not been built against monkeypox, and the chances of contracting monkeypox is high, especially when in contact with either an infected animal or an infected person. Now, beyond just an infected person, the beddings, the clothes, the saliva, and other personal effects of the infected person can serve as a mode of transmission. Like I did say, mere kissing, mere cuddling, skin-to-skin contact, all of this can serve as a channel or a mode of transmission of monkeypox. So lack of vaccination exposes an individual to the risk of contracting this virus. Now, the third risk factor is poor hand hygiene. Poor hand hygiene. We often advise that when you have probably made use of the toilet or before you prepare the food that you're eating, you're supposed to be able to, wash your hands either with warm water and soap, or sanitize your hand with a sanitizer. Now, the thing is, if you make contact with your hands on maybe the materials that is used by, let's say, for example, the beddings or other personal effect of an infected person, or maybe you have a very close contact with such a person, your hands may be contaminated. For example, if you have maybe an interaction with somebody and the person laughs, shouts, or sings, there's a possibility that saliva or nasal products from either the nose or the mouth or the pharynges may be emitted, and they may drop in your hands. And if you make contact with that infected or contaminated hand in this case, then you stand a greater chance of having the virus transmitted to you. Again, another risk factor is not using face mask. Like we said, if you know of a patient or you know of somebody that is being suspected to be living or to be having monkeypox, it is important that when interacting with the person that you wear a face mask. And it is because of the reason I stated earlier. that saliva or nasal products, for example, sputum and other, fluid from the body, can serve as a mode of transmission of monkeypox from an infected person to a susceptible person. So inability or reluctance or lack of wearing a face mask when interacting with a monkeypox suspected or confirmed individual or patient can be a very, very veritable mode of transmission of monkeypox. Apart from that, general personal hygiene and environmental sanitation can be a very, very important, can be a very important mode of transmission. If you don't keep a good personal hygiene and a good environmental sanitation, you may expose yourself, because sometimes some of these rodents that are infected with monkeypox can make contact with our foods. If we leave foods open, they can make contact with those food, drop their saliva or other fluids, and anyone who ingest or consume that food stands a chance of being infected with the virus. Another thing is inability to properly cook foods, especially properly cooked bushmeats. A lot of animals, rodents in the bush, are used by humans as bushmeat. Unfortunately, in many cases, these bushmeat are not properly cooked. And because they are not properly cooked, the virus in the infected bushmeat can be transmitted to the human host. And once that transmission occurs, the human or the susceptible individual can come down with the virus. So these are some of the mode of transmission of the virus. And suffice it to say that from this mode of transmission, it is very easy to be able to develop a very, very effective public health strategy to ensuring that we can cut the chain of transmission by protecting ourselves, our families, and our loved ones from the virus by avoiding some of the risk factors that increases our chances of coming down with this virus.
So what key strategies should the government put in place to control the future spread of monkeypox in Nigeria?
The most important strategy is vaccination. Vaccination is an insurance policy against monkeypox, because unfortunately, monkeypox spreads very, very wild. And within the early days of the infection, symptoms are not quite evident. So it is possible for one to have that contact with somebody who is infected with the virus without knowing. But if anyone is vaccinated, it helps to protect him or her against the virus. So it is the duty of the government to make sure that vaccination programs are rolled out. Thank God, or good enough, the World Health Organization, in their last report, indicated their interest in engaging with monkeypox vaccine manufacturers to be able to stockpile millions of doses of the vaccine. The idea is to ensure that they are available for countries that need the vaccine to be able to protect their citizens against the virus. So it is important for governments across the African region to liaise with international donor agencies and private sector to ensure that vaccination is available free of charge and to every facility, so that Nigerians and other people within the African sub-region where this disease is endemic can go and have access to vaccine. With vaccination, we can actually reduce the transmission of monkeypox from human to human. Again, the government should be able to conduct what we call surveillance, all right? Epidemiological surveillance of major abattoirs in the country. A lot of abattoirs are served as a mode of transmission of some diseases such as monkeypox to many people, because infected animals are killed in the public where people buy and sell. Now, this, like what happened with the COVID-19 in Wuhan city, where in a meat market, the virus was transmitted from person to person. It is the same thing can also occur with monkeypox, where infected animals or bushmeat are processed in abattoirs. And once this happens, people who are exposed to these animals stand a greater chance of being infected. So the government should be able to conduct regular inspection or surveillance in these abattoirs to ensure that global best practice in terms of sanitation is adhered to by all the practitioners within these abattoirs. It is important that the government should be able to use this surveillance report to inform decision making, to ensure that where facilities are lacking, enough facilities are provided to ensure that the process of processing animals is done in a very aseptic manner. This is one of the strategy that the government can use. Again, the government should be able to create awareness, because a lot of people in Nigeria don't even know about monkeypox. They don't know about it. They feel that it's a horse, that is something, it's just a myth. The government should be able to strengthen information dissemination and manage the information, what we call infodemic management, manage information around monkeypox. They should be able to liaise with traditional and religious organizations to ensure that the message of monkeypox get down to the grassroots. They should work with the community, with relevant community-based organizations, the media houses, and the schools, to educate our children and let them be aware, because children are one of the very, very important tools of dissemination of information. The government should explore every opportunity whatsoever to ensure that the information and awareness, education, public health education about monkeypox gets to everyone. Because if everyone is aware, then everyone will be able to take preventive measures that will help protect all of us, at least the most of us, against this deadly viral disease. It is important for the government to also ensure that resources are available. For example, the government may be able to ensure that face masks are available at very affordable rates for Nigerians or other Africans to be able to have access to. Government should also be able to ensure that we have hand sanitation equipment or facilities in all public places, especially public offices, so that every Nigerian, everyone should be able to have the opportunity of engaging in hand sanitization by either washing their hands or using hand sanitizer. By so doing, we will help to significantly limit the spread of the virus from person to person and ensure that in no longer time from now, we are able to reduce the incidence and on the long term, the prevalence of monkeypox in Nigeria as well as in the entire African region.
What are the clinical symptoms and complications associated with Mpox?
Yeah, so there are a lot of them. There are a number of complications that are associated. We have quite a number of them. And suffice to say that these complications can be traceable to the symptoms and can also be traceable to the mode of transmission. For example, we have pneumonia. Pneumonia is a respiratory disease that occurs, that leads to a lot of other, in fact, it's a lower respiratory tract infection that can lead to severe symptoms like difficulty in breathing, hyperthermia, and other very, very severe symptoms. We've noticed in some cases of monkeypox complication that patients come down with pneumonia. Also, otitis media. Otitis media is inflammation of the middle ear. These are some of the complications that we've seen. We even have other complications like vaginal discharge. We have complications like skin severe skin inflammation. We have even some reports have been made. Some reports have made the round that we some to an extent kidney damage, liver damage, and even vascular damage can result from monkeypox. So, of course, we have hemorrhagic fever is one of those conditions that are caused as a result of severe cases of monkeypox. So we have lots of those complications. But I would advise that if one suspects that he or she may be having monkeypox, or if one had contact with somebody that is suspected or confirmed to be living with monkeypox, do not wait for the symptoms to occur. Immediately report yourself through a contact tracing protocol, and you will be linked to an isolation center where you'll be isolated for the period of time, for the period of the incubation period until symptoms are manifested, and with proper management. Of course, monkeypox is a self-limiting virus, so it will definitely go on its own. Though we also recommend supportive care, which helps to maintain body functions while the individual goes through the incubation phase of monkeypox. There are other antiviral medications that can be used as to support. We can also, give oral fluid. But what is important is that patients or individuals should not wait for symptoms to occur, because most times when those symptoms occur, the disease has to go through its cycle. And once it goes through its cycle, in some cases, it will produce very, very severe complications that leads to death. And which is why monkeypox has been found to kill at least 10% of those it infects. So, and those mortality rate is as a result of the complication, not necessarily as a result of the monkeypox itself. So it's important that we watch out for the symptoms, and once watch out for the symptom, or even when we don't have the symptom, we go to we seek medical advice, or we speak to a healthcare professional so that we can take necessary steps to ensure that we are treated and that we recover successfully from this virus. So those are the complications. There are other complications as knowledge begins to grow. There are other complications that are being unraveled on a daily basis, and such, when documented, will be used to characterize nature and the cycle of monkeypox in victims or people who are suffering from monkeypox.
Well, public health specialist Dr. Nsiabasi Ekanem, thank you for lending your thoughts on the program. And that's all we can take on this episode of the program. I am Ogechukwu Ukekwe. Bye for now.